lot of people are asking for what kind of offers and specials should they do?
Great question. I want to, instead of answer that question with a specific offer or specific discount or whatever, because some people get rubbed wrong by the suggestion of doing discounts or offers. I want you to think with this. People are hesitant in going forward for a number of reasons. One of them is trust. It's a big one. Another one is need. Do they see they need it? You may see that they need it, but do they really see that they need it? Another one is price, but price isn't necessarily the factor that makes us move or not move. And I ask you this question, and you can ask your patients this question. Would they spend a couple extra dollars in a purchasing decision if they knew they were gonna get much better service? Many people will say yes. Not everybody. Not everybody. There's some people who always just want the cheapest, and they don't care what the service is, they just want the cheapest. You might not be wanting that patient, but just think about that. So price is a factor. One of the biggest factors is urgency. Urgency. Price, it's not a big factor. Trust is a big factor. Need is a big factor. And urgency is a massive factor. So your job is to make sure that they first trust you, and that's your online profile we help you with. That's your online reviews, your testimonials, your good work, your smile gallery. Show that you have done this with many other people many times, and it's indisputable. So that's a trust factor. Second, need. Make sure you have your hard sell in, meaning you care enough about that individual to help them to understand the treatment plan and to get them over the stops and barriers that are preventing them from getting the treatment they need to be fully healthy and rehabilitated. That's hard sell. That's need. Price, I don't want you to fixate on price. Urgency, this is where offers come into play. Urgency is, listen, you could walk out of here today, bite down on a breadstick tomorrow, snap that tooth right down the middle, and now we're not talking about a crown anymore. We're talking about something more invasive and more expensive, like an implant. We do them here. I can do them all day long, or we have associations with specialists who can do them, but they're more expensive and they're more invasive. And you have mentioned to me that price is a concern and you don't like needles and drills. Well, again, that's more invasive and more expensive. So I don't want to go there. So I don't want to play with fate. Let me ask you this, Mr. Jones, Mrs. Jones. If you had to, say you had a financial emergency, I've used this scenario before, such as your car breaks down and you only have one car and you got to get to work and you got to pick up your kids and you got to do this, you got to do that. How would you handle that financial emergency? How would you handle that financial, because it's an emergency, you got to pay $5,000 to get your car fixed. How would you handle that emergency financially? Well, I guess I'd put it on a card, but I really don't want to do that. I just paid off all my cards. Totally understood. Now you know that it's not a price thing. It's at this point not an urgency thing, so it's yours to bring that urgency home. Why are we talking about that in the point of offers? Well, think about offers. What does an offer do? A special promotion do? If you give me a limited time offer and say I'm looking at elective, I'm looking at 8 veneers. 8 veneers is going to cost me some money, but if you've got a special, if I do 6 veneers, we'll get 1 thrown in, or Invisalign, $500 off Invisalign, or come in for this or come in for that. It impels me to move now when I might not move. So we've got a bunch of them. I can do some examples if you'd like, and I'll cover that in a separate video lesson, but I want you to think with getting the urgency factor. Yes, an offer might get me to call you. Now you're gonna have to give me urgency to go forward with the treatment. So the important thing you understand is that it isn't price, it is trust, it is need, and it's urgency.